Welcome to this tutorial on applied nutrition, brought to you by Medical Biochemistry Power Capsule series. This video covers the following CBME curriculum topics: describe the types and causes of protein energy malnutrition and its effects. Provide dietary advice for optimal health in childhood and adults, in disease conditions like diabetes mellitus, coronary artery disease, and in pregnancy. Describe the causes, including dietary habits, effects, and health risks associated with being overweight and obesity. Protein energy malnutrition is a condition that arises due to a deficiency of protein, energy, or both, in the diet. It is particularly common in regions with food insecurity, but can also occur in individuals with certain medical conditions, inadequate dietary intake, or malabsorption issues. Protein energy malnutrition can lead to significant health issues, stunted growth, weakened immunity, and increased susceptibility to infection and disease. It encompasses a spectrum of nutritional deficiencies, with kwashiorkor and marasmus representing its most severe forms. Kwashiorkor is a type of protein energy malnutrition characterized by adequate or sometimes even excessive caloric intake, but inadequate protein intake. It is commonly seen in children, often due to a diet rich in carbohydrates but low in protein. The main signs and symptoms of kwashiorkor include edema, skin and hair changes, fatty liver, irritability and lethargy, muscle wasting, and other symptoms like anemia, weakened immune response, and stunted growth. Marasmus is another severe form of protein energy malnutrition characterized by a chronic lack of calories and protein. Unlike kwashiorkor, marasmus is a state of near total starvation, with inadequate intake of all macronutrients. The main features of marasmus include severe wasting, skin and bone appearance, but absence of edema, stunted growth, hunger and emaciation, reduced subcutaneous fat, weakness and fatigue, and other symptoms like thin brittle hair, diarrhea, and delayed wound healing. The prevention of protein energy malnutrition involves ensuring adequate nutrition, with a balanced intake of protein, carbohydrates, fats, vitamins, and minerals. This is particularly important for infants and young children, pregnant women, and the elderly, who are at higher risk. Treatment involves a multi-step approach. Stabilization, addressing acute medical issues like dehydration, infections, and electrolyte imbalances. Refeeding, gradually introducing a nutrient-rich diet to restore protein and energy levels. Micronutrient supplementation, providing vitamins and minerals to address specific deficiencies. Long-term care, ensuring consistent nutritional support, education, and monitoring, so as to prevent relapse. Overweight and obesity are conditions characterized by excessive body fat accumulation that may impair health. The most common measure used to assess overweight and obesity is the body mass index, where a BMI of 25 to 29.9 is considered overweight, and a BMI of 30 or higher is considered obese. Both conditions are rising public health concerns, with significant implications for individual health and healthcare systems. The development of excessive body weight and obesity is complex and can involve a combination of several factors. Diets high in calories, unhealthy fats, like trans fats, and added sugars, can contribute to excessive weight gain. Consuming large portions or frequent snacking on energy-dense foods with low nutritional value, sugary beverages, and processed foods can cause obesity. Lack of regular physical activity and prolonged periods of sitting leads to reduced energy expenditure. Increased reliance on cars, elevators, and other conveniences that reduce physical exertion is another factor. Certain genetic factors can predispose individuals to gain weight more easily or have a slower metabolism. Defects in lipid metabolism, such as familial hypertriglyceridemia, can also result in excessive weight gain. The built environment may not encourage physical activity. The availability and marketing of unhealthy foods can influence dietary choices. Other contributing factors are as follows: limited access to healthy foods or safe environments for exercise. Economic constraints may lead to reliance on cheaper, calorie-dense foods. Emotional eating, stress, and mental health issues can lead to unhealthy eating patterns. Eating disorders, like binge eating disorder, may contribute to obesity. Certain conditions, like hypothyroidism, Cushing's syndrome, can affect weight. Medications, such as steroids and some antidepressants, can contribute to weight gain. The effects of overweight and obesity are profound, impacting both physical and mental health. Health risks associated with these conditions include the following: increased risk of hypertension, coronary artery disease, heart attack, and stroke, type 2 diabetes and insulin resistance, and dyslipidemia, obstructive sleep apnea, risk of asthma, and other respiratory disorders, osteoarthritis, chronic back pain and reduced mobility, non-alcoholic fatty liver disease, which can progress to cirrhosis, higher risk of gastroesophageal reflux disease, higher risk of breast, colon, prostate, and endometrial cancers. Other untoward effects of obesity and excessive weight include infertility, polycystic ovary syndrome, and menstrual irregularities in women, reduced testosterone and sexual dysfunction in men, increased risk of depression, anxiety, and low self-esteem, social stigma, discrimination, and reduced quality of life. Let's go through the hormonal mechanisms involved in obesity. Obesity is a multifaceted condition influenced by a range of factors, including genetic, environmental, behavioral, and hormonal mechanisms. Hormones play a crucial role in regulating appetite, energy balance, and fat distribution. The interplay between these hormones can significantly affect body weight and the development of obesity. The major hormones involved include leptin, ghrelin, insulin, cortisol, adiponectin, peptide Y2, and cholecystokinin. In many cases of obesity, there is a condition called leptin resistance. Despite having high levels of leptin due to increased fat mass, the brain doesn't respond appropriately to the hormone, leading to a lack of satiety and continued overeating. This resistance can contribute to the persistence of obesity. Leptin is a hormone produced primarily by adipose tissue. It is often referred to as the satiety hormone because it plays a critical role in regulating appetite and energy balance. Leptin is released by fat cells into the bloodstream and acts on the hypothalamus in the brain to suppress appetite and increase energy expenditure. It serves as a signal to the brain that there is enough stored energy, thereby causing a feeling of fullness and reduced food intake. Ghrelin is known as the hunger hormone. It is produced mainly in the stomach and has a significant impact on appetite regulation and energy balance. Ghrelin levels increase before meals and decrease after eating. It stimulates appetite by acting on the hypothalamus, promoting the desire to eat and reducing energy expenditure. In obesity, ghrelin levels may not decrease as much after eating, leading to prolonged hunger signals and overeating. Ghrelin can also promote the accumulation of visceral fat. Insulin is a hormone produced by the pancreas, primarily responsible for regulating blood glucose levels. It also has significant implications for obesity. Insulin facilitates the uptake of glucose into cells for energy and storage. It also plays a role in lipid metabolism and the regulation of fat storage in adipose tissue. In obesity, insulin resistance can develop, where cells become less responsive to insulin, leading to higher blood glucose levels. This condition can result in increased insulin production, promoting fat storage, and making it more difficult to lose weight. Insulin resistance is also a key factor in the development of type 2 diabetes. Cortisol is a hormone produced by the adrenal glands in response to stress. It has a complex role in metabolism and can contribute to obesity under certain conditions. Cortisol helps manage stress, regulates metabolism, and maintains blood pressure. It influences glucose metabolism and can promote the breakdown of muscle proteins to increase blood glucose levels. Chronic stress and elevated cortisol levels can lead to increased appetite, particularly for high-calorie, carbohydrate-rich foods. This can result in weight gain, especially in the abdominal area, where cortisol tends to promote fat storage. In addition to leptin, ghrelin, insulin, and cortisol, several other hormones and factors play a role in obesity. Adiponectin is a hormone produced by adipose tissue that increases insulin sensitivity and has anti-inflammatory effects. Lower levels of adiponectin are associated with obesity and insulin resistance. Peptide Y2 is a hormone released by the gastrointestinal tract after eating, contributing to satiety. Reduced levels of peptide Y2 can lead to increased appetite and obesity. Cholecystokinin, another hormone involved in satiety, is released by the small intestine. It helps slow gastric emptying and reduce appetite. Achieving optimal health outcomes through diet involves making balanced and nutritious food choices throughout life. In the subsequent section of this video, you shall come across some general recommendations for maintaining a healthy diet during childhood and adulthood to support growth, development, and long-term well-being. In childhood, proper nutrition is crucial for growth, development, and establishing lifelong healthy eating habits. Here's a comprehensive guide for a balanced diet in children. Balanced macronutrient intake. For carbohydrates, emphasize whole grains such as whole wheat, brown rice, oats. Over-refined grains include a variety of fruits and vegetables. Encourage consumption of lean proteins such as chicken, fish, beans, legumes, and low-fat dairy products. Eggs are also a good source of protein. Include healthy fats like those found in avocados, nuts, seeds, and fish rich in omega-3 fatty acids. Intake of saturated and trans fats has to be curtailed. Adequate micronutrient intake. Ensure a varied diet rich in fruits and vegetables for vitamins and other antioxidants. Include dairy or fortified alternatives for calcium and foods like leafy greens for iron, for children with dietary restrictions. Supplements may need to be provided after proper consultations, such as vitamin D for children with limited sun exposure, and vitamin B12 for vegetarians. Beverage choices should be healthy and water is to be encouraged as the primary beverage. Other factors, low-fat or fat-free milk, or fortified plant-based alternatives, is preferred for calcium and vitamin D. Sugary drinks has to be restricted. Restrict sodas, fruit juices with added sugars, and energy drinks. Choice of snacks needs to be healthy. Provide snacks made from fruits and vegetables, yogurt, or whole grain crackers. Limit processed snacks. Avoid sugary snacks, chips, and high-fat processed foods. Promote family meals. Eating together as a family can foster healthy eating habits and create opportunities for role modeling. Physical activity has to be encouraged. Promote outdoor activities, sports, and other forms of exercise to complement a healthy diet. In adulthood, dietary choices play a key role in maintaining health, preventing chronic diseases, and supporting overall well-being. Here are some tips for a balanced adult diet. Prioritize whole grains and complex carbohydrates. Include a variety of vegetables and fruits. Incorporate lean proteins such as poultry, fish, tofu, legumes, and eggs. Limit red meat and processed meats. Choose healthy fats like those from nuts, seeds, olive oil, and fatty fish. Minimize saturated fats and avoid trans fats. Ensure a diverse diet rich in fruits, vegetables, and whole grains. Include dairy or dairy alternatives for calcium, and foods rich in iron, potassium, and magnesium. Consider supplements based on specific needs such as vitamin D for those with limited sun exposure, vitamin B12 for vegetarians and vegans. Make water the primary beverage throughout the day. Reduce consumption of sugary sodas, sweetened teas, and high-calorie coffee drinks. Establish a regular eating pattern with balanced meals. Be mindful of portion sizes to avoid overeating. Home cooking is best. Cook at home when possible to control ingredients and portion sizes. Aim for at least 150 minutes of moderate intensity exercise, or 75 minutes of vigorous intensity exercise per week. Include strength training exercises at least twice a week to maintain muscle mass. Practice stress reduction techniques such as mindfulness or yoga, as stress can impact dietary choices. Ensure adequate sleep, as sleep deprivation can affect appetite-regulating hormones. Proper nutrition plays a crucial role in managing health conditions and supporting overall well-being. The following section provides diet-related information tailored to 3 distinct groups: diabetic patients, cardiovascular disease patients, and pregnant women. Each section addresses specific dietary needs. Diabetes is a chronic condition characterized by high blood glucose levels. Managing diabetes requires a balanced diet that helps control blood glucose, reduce cardiovascular risk, and maintain a healthy weight. Choose complex carbohydrates. Focus on whole grains, like brown rice, quinoa, and whole wheat bread, legumes and vegetables to promote steady blood sugar levels. Monitor carbohydrate intake. Work with a healthcare professional to determine the appropriate carbohydrate intake. Carbohydrate counting, or the glycemic index, can be useful tools. Distribute carbohydrates throughout the day. Eat smaller, more frequent meals to maintain stable blood glucose levels. Focus on healthy fats. Choose fat sources from foods like avocados, nuts, seeds, and olive oil. These can support heart health. Limit saturated and trans fats. Reduce intake of fried foods, baked foods with trans fats, and high-fat dairy products. Emphasize lean proteins. Lean sources include poultry, fish, beans, and tofu. Cut down on red meat and processed meats, which are high in saturated fat and cholesterol. Choose healthy snacks that contain protein and has low glycemic index. Limit added sugars. Reduce sugary drinks. Avoid sodas, fruit juices with added sugars, and sweetened coffees or teas. Choose natural sweeteners with low glycemic index. Coordinate meal and snack times with insulin or medication schedules to maintain consistent blood sugar levels. Regular monitoring of blood glucose is essential. Keep track of blood glucose levels to understand how different foods affect them. Patients with cardiovascular disease require a heart-healthy diet to manage risk factors like high cholesterol, high blood pressure, and obesity, and maintain a healthy weight. DASH or Mediterranean diet is considered a healthy diet for cardiovascular disease patients. These diets are rich in whole grains, vegetables, fruits, and healthy fats. They are known for supporting heart health. Sodium intake has to be reduced. Aim for less than 2,300 mg of sodium per day, or less if advised by a healthcare provider. Avoid processed and high-sodium foods. Emphasize lean proteins. Include fatty fish, which are rich in omega-3 fatty acids, which are beneficial for heart health. Limit red meat. Choose lean cuts and reduce processed meats. Incorporate healthy fats. Include sources like nuts, seeds, avocados, and olive oil, which contain unsaturated fats. These fats can help lower bad cholesterol levels. Limit saturated and trans fats by avoiding fried foods, processed snacks, and high-fat dairy. Prioritize high-fiber foods. Whole grains and legumes contain fibers. Consuming fiber-rich foods helps reduce cholesterol and supports heart health. Aim for a variety of colorful vegetables and fruits daily. Portion sizes need to be managed. Ensure balanced meals that contain a variety of food groups in appropriate portions. Avoid overeating. Use smaller plates and eat mindfully to prevent excessive calorie intake. During pregnancy, a balanced diet is essential for the health of the mother and the developing baby. Proper nutrition can help reduce the risk of complications and support a healthy pregnancy. Focus should be on nutrient-dense foods. Whole grains are good. Include complex carbohydrates, lean proteins, and dairy or dairy alternatives. Aim for a wide variety of fruits and vegetables to obtain essential vitamins and minerals. Ensure adequate micronutrient intake. Folic acid is important for preventing neural tube defects. Include folate-rich foods, like leafy greens, and take a prenatal supplement with folic acid. Iron supports increased blood volume during pregnancy. Consume iron-rich foods and consider a supplement if needed. Calcium and vitamin D is essential for fetal bone development. Include dairy products or calcium-fortified alternatives and get adequate sunlight or vitamin D supplements. Omega-3 fatty acids are important for fetal brain development. Include fatty fish, but avoid high-mercury fish from polluted water sources. Maintain hydration. Drink plenty of water throughout the day. Limit caffeinated beverages. Practice safe eating. Avoid raw or undercooked foods to reduce the risk of foodborne illnesses. Manage weight gain. Weight gain should be according to guidelines based on pre-pregnancy body mass index. Engage in moderate exercise, such as walking or swimming, with the approval of healthcare provider. This tutorial has been explicitly designed to impart instruction and provide information to medical students. The contents of this tutorial should not be construed as any sort of professional advice regarding diet and nutrition. Exact dietary requirements vary from person to person. It also depends on the exact nature of disease conditions. Hence, for matters related to dietary issues and nutritional issues, proper advice has to be sought from professional nutritionists, or doctors, or healthcare providers.
Thanks for watching this video. Our next tutorial in the Medical Biochemistry Power Capsule series is titled Extracellular Matrix. The tutorials presented in the MBPC series are not intended to be a substitute for your textbooks. However, we feel that these tutorials can prove to be very valuable as complementary educational aids and for purpose of rapid revision prior to exams. If you have enjoyed this video, don't forget to hit the like button, subscribe for more exciting content, and share with your friends. And do keep watching our channel to remain ahead in the game.